Hi, I'm Waridibo Allison. I'm the director of the UT Health San Antonio ECHO program, and I'm going to talk today about UT Health San Antonio Extension for Community Healthcare Outcomes ECHO program and the journey we have taken to get to this point. So I'm going to start with an overview video of the ECHO model.
The Project ECHO model delivers specialist medical knowledge to regions most in need. It spreads new knowledge from teaching hospitals and academic centers to the front lines of primary care and community care. Rather than expertise residing in a hospital, healthcare providers learn from experts, they learn from each other, and hospital-based experts learn from community partners as new best practices emerge. Under ECHO, community teams use video conference technology to participate in case-based learning with expert mentors. They acquire new skills that allow them to care for patients they would otherwise need to refer on. Patients with complex conditions get high-quality care closer to home from healthcare providers they know and trust. No waiting months to access care. No long trips back and forth to hospitals or clinics. ECHO exponentially increases access to best practice care by moving knowledge instead of moving patients. ECHO has the potential to increase healthcare access locally and globally. Time lost from work and school is reduced, and more patient-centered care is delivered. UT Health San Antonio ECHO, improving access to healthcare in communities. Are you part of the ECHO?
So the ECHO model moves knowledge, not patients. The principles of the model are utilizing technology, telecommunication technology, to leverage resources. The model improves outcomes by sharing and standardizing best practice, and it follows case-based learning, fostering deep knowledge and skills and self-efficacy. Data is also collected and tracked to monitor outcomes and inform quality improvement. Each ECHO session looks similar. So within an ECHO session, you have brief didactics that are usually 5 to 10 minutes. Sometimes they can be as long as 15 minutes, and those reinforce content knowledge and share evidence-based practice. And then every ECHO has case-based discussions. Cases are sometimes patient-based, but they can sometimes not be patient-based and can be more operational. When they are patient cases, the cases are always de-identified, and then group discussion happens that is very non-hierarchical, and the learning is question-driven. Continuing education is provided at no cost, and depending on the session, it might be CME, it might be MOC, it might be other forms of CE. So how did this all start at UT Health San Antonio? So in 2017, I was awarded a HRSA Health Resources Services Administration grant that is a Ryan White Special Project of National Significance to cure hepatitis C in people of color living with HIV. And the acronym for that project is Tackle HIV-HCV. There are a lot of goals and activities within that project, but the one I want you to focus on is the second goal. And so that was to provide support for non-specialist providers to treat hepatitis C for patients within their medical home. So non-specialist providers that already treat HIV. And so that support was provided by disseminating the AETC, AIDS Education Training Center, National HIV-HCV curriculum, but also utilizing the ECHO model to teach and support primary care providers for management of hepatitis C. We also focused a lot on process evaluation throughout this entire project rather than just on impact and outcome evaluation. We had the luxury of having a whole year within that project for planning and infrastructure, and the text that is in black there on the right shows the different things that we did for establishing our ECHO through our ECHO program, our ECHO HIV/HCV specific echo during that time. And so we established HIV echo forms, accreditation, the video that you just saw. We launched our Tackle project and echo websites, and then we created resources for providers for managing hepatitis C. So a drug access protocol for accessing drugs, whether the patient was insured or not, and also provided HCV drug decision trees for selecting the right drug to treat hepatitis C. This very busy slide shows a lot of the information flow throughout the Tackle HIV/HCV project. And again, you can see that ECHO is just one part of a very larger project. This is a slide that shows the stats for our ECHO at our project conclusion meeting, which was last year. So at that time, the ECHO was launched. Our ECHO was launched in September 2018 and has been running for 2.5 years. We've had about 51 sessions, 56 cases have been presented, and we've had nearly 1,300 attendees. Average attendance at an ECHO session, an HIV/HCV ECHO session, was about 25 participants, and people with HIV reach were calculated from the panel size of the providers attending the session. And so 3,372 people with HIV were reached, and nearly 120 co-infected individuals. You can see in that second column that it says HIV. So this HIV/HCV echo evolved into an HIV monoinfection echo, where we see HIV/HCV co-infection cases within that echo. So the program origin, the UT Health San Antonio program origin, was within this special project of national significance to cure hepatitis C in people of color living with HIV. But there was considerable interest from other departments, divisions, and schools in our institution for starting echoes related to other subjects and disease states. And so I recognized with my team the importance and the opportunity for centralizing echo resources at our institution and for starting an institutional echo program. We had conversations with a variety of people, and our departmental service center application was approved in January of 2020. So roughly a year and a nearly 2 years after we'd initially started our ECHO program in September of 2018. So a year and a half. So what does the UT Health San Antonio Echo Service Center provide? So as I've already said, the goal is to centralize echo resources. We provide core services, so echo launch support, administrative support, communications and promotion assistance, and it's really important because there's institutional accountability and built-in sustainability for echoes that are started. Some supplemental services are also provided if a department or a division or an individual investigator wants them. So staffing for coordination, facilitation, and IT support, if additional training is needed for the team that's going to be running the ECHO, if assistance is needed with development of the curriculum for the ECHO, and then if support is needed for CE provision for that ECHO. Some teams also want assistance with developing a database for data collection within that ECHO and for outreach to recruit participants for their ECHO. So a very broad range of services are provided by the service center. So ECHO can be used for a variety of things, and some of the different applications are summarized here. Clinical knowledge and task shifting, and so an HIV echo, our HIV echo is an example of that. Workforce development and training, and the mood echo, the medication for opioid use disorder, is an example of that. It can also be used for rapid implementation, clinic management, and operational support. And our COVID-19 telemedicine implementation echo is an example of that. And then for professional development activities, our RAISE, resources, advice, insight, support, and empowerment for early career faculty women. Women faculty is an example of echo utilized for professional development activities. So I'll just go into a little more detail about each of those individual applications and the echoes I gave as examples. So our clinical knowledge and task shifting example, our HIV-HCV echo, which as I described to you earlier, became an HIV echo within which we see co-infected cases. We have a team that has a broad base of expertise. So we have ID specialists there, we have hepatologists there, we include PharmDs, both an academic medical center, PharmD Dwayne Davidson, and a community-based PharmD, Margaret Aji. Community health workers are also included there, and we also have mental health and behavioral health specialists on our team. That echo has been running since October 2018 and continues to run. The medication for opioid use disorder, Texas Mood Echo, is an example of workforce development, and that echo is based on providing resources for substance use disorder best practice, and that is run by Dr. Jennifer Potter and her team. And you can see here the people that are involved in that echo. Those sessions occur monthly. So in March 2020, at a time when there was very little information available for very quickly standing up telemedicine within clinics, we started what we called a COVID-19 Telemedicine Implementation and Technical Assistance Echo. And it was very operational. It wasn't clinical patient case-based. It was based on cases. The cases that were presented were clinics presenting where they were up to at very different stages of implementation of telemedicine. And the resources that we provided were giving them everything that they needed in terms of information for starting up a telemedicine program at their clinic, from hardware to software, and then also teaching them the regulatory requirements around standing up telemedicine. So at the time that we had the emergency declaration, a lot of the usual legal requirements for starting up an echo were no longer there, but people had to understand what they were, so that as soon as the emergency declaration was lifted and those things came back into play, people were aware. So those were the short and long-term considerations. That echo was our planning began on March 19th, and the series was launched 11 days later. Now, we don't recommend planning an echo in 11 days, but because of the urgency of the need at the time, we were able to do that. The initial series ran for 10 weekly sessions, and then as a sustainability move, we then moved that to become an HIV telemedicine implementation echo that was very Texas focused, whereas this initial echo was nationally focused, and I think we even had somebody call in from Canada. So the other application, professional development. So this RAISE Echo, Resources, Advice, Insight and Support and Empowerment for Early Career Women Echo. This was an echo that I conceived with, the idea was conceived with Dr. Emily Bale, who has now moved on to Penn, but it was launched in November 2020. The sessions are led by a national network of career development experts and academic leaders who give the didactics, and then the sessions are facilitated by early career women faculty. Those sessions run monthly. We had a bit of a break in the summer, but we're starting up again this month, and we provide free CME and MOC. The cases are de-identified and anonymous, and they're real cases about early faculty challenges that early faculty women have faced, whether it's microaggressions, whether it's around promotion and tenure, chronic illness, family leave, maternity leave, racism. We've just had a burnout. We've had a whole range of robust discussions and great advice and mentorship input from senior faculty. We've had senior faculty with national reputations presenting at those echoes and being available to the women attendees at those RAISE echo sessions. So it's been really gratifying, and their time is not reimbursed. So it's been really great to see how willing they are to give their time for something like this that is to help the professional development of early career faculty women. So our current UT Health San Antonio echoes are listed here, and you can see that there's a whole range of them, from the RAISE echo that I mentioned for professional development to Chagas disease echo for providers that's run by Dr. Paula Stiegler that's now in San Diego. Yeah, a whole variety of echoes that we now run within our program. There are some echoes that have started and then no longer run. So the COVID-19 Telemedicine Implementation and Technical Assistance echo ran initially for 10 weeks, and as I said, folded into an HIV care continuum telehealth technical assistance echo, and that ran through to June of this year. In March 2020, if you'd gone online trying to find information about implementing a telemedicine program or telehealth program at your clinic, there was little information available. There's now a lot more information available, and so we felt that we could now kind of come out of that space. And so, having run for just over a year, that echo ended. We've had an STI telemedicine technical assistance echo that ran for a discrete period of time. Same with an echo that was around building resilience for DACA recipients and mixed status families in the face of adversity. The HIV-HCV co-infection echo that I mentioned previously has now been combined with an HIV echo. And then the echo that came before the Texas mood echo was the Get Wavered Texas buprenorphine for opioid use disorder echo that was also run by Dr. Jennifer Potter and her team. We have some echoes that are planned within our program, so a Chagas disease echo for community health workers and a disaster relief preparedness echo. I think you're seeing the theme that echo can be used for a wide variety of things, and some of them are very disease-focused and clinical patient care focused, and some of them are not. So a snapshot of what our Echo Service Center has done, since over the last few years, we've supported the launch of 17 different echoes. We continue to provide primary services, grant support, strategic planning, staffing around facilitation, IT support, iEcho entry and coordination. And so we're now in this new phase of launching UT Health San Antonio Echo as a Superhub. What is a Superhub? It's authorization from University of New Mexico Echo Institute that allows UT Health San Antonio to train other institutions and organizations as Echo Hubs. We're one of 11 Superhubs in the country and one of 3 Superhubs in Texas. Our staff completed Superhub training in August of 2021 of this year, and we officially became an Echo Superhub at that time. Becoming a Superhub provides new opportunities for cross-institutional collaboration and partnership, and we will be having our first immersion training in January of 2022. So would I have envisioned this back in 2017 when I thought of Echo as a model for training primary care providers to treat hepatitis C in people living with HIV within the Tackle HIV/HCV project, no, I wouldn't have envisioned that we'd get to this point. Beyond improving care delivery and access, ECHO has value that we've demonstrated in building visibility in our community, in the healthcare community, through ambassadorship and partnership to improve health. It's fostered interdisciplinary and cross-institutional collaboration. It's been shown to be valuable as a research tool or as an intervention method in research projects, and it's been shown to be useful in advancing translational research. And so with those final thoughts, I'll end. Thank you for joining us for this launch event. I hope you'll be able to join various events through this UT Health San Antonio ECHO Superhub launch week. Please connect with us. Here's our website information, our social media information, and our email. Thank you for your attention.